Hello guys, vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. Welcome back to Magic Pearl session. In Magic Pearl session, we are discussing previous year question papers, and in this video, it is actually a part 2 video of PGI question paper solution. PGI exam taken place in November 2025 last month, and we are solving the question paper. So most of the question we already solved, and it is there in part 1 video. It is there streaming in YouTube channel. Those who doesn't watch the video, please watch that first and then come back to this video. Okay, fine. So this is a part 2 video of PGI Chandigarh Nursing Officer Exam question paper solution. Okay, so already most of the questions we have discussed. Whatever the question you are seeing here is already discussed. And let's start from the new question. So this one. What should be the first action following a needle stick injury after an IM injection? So this is the question. First action they are asking after the needle stick injury. That's all. Direct question. 4 options they have given. Wash with sterile water. Wash in your running water for 5 to 10 minutes. Cover with a bandage. Apply povidone iodine solution. Among these 4, which is going to be the right answer? Yes, obviously, after the needle stick injury, we should wash the hand in the direct running water. Don't squeeze. Don't squeeze. Because in most of the exam, this option was there. Okay, squeezing. After the needle stick injury, squeezing. This option will be there in the exam. That is a wrong answer. Okay, you should not squeeze it. Always you should wash your hand needle pricked area in a running water for 5 to 10 minutes. No need to search for sterile water. Just normal tap water, running water is enough. Clear? Right? Fine. So here it is a direct question, and here the right answer is going to be option B. Wash in the running water for 5 to 10 minutes. Okay. Second, the Montax test is used for the screening of, very simple, direct question. You know that Montax test is used for the screening of TB. Right answer is going to be TB. Additional golden points are, in the Montax test, you are going to use an injection, intradermal injection. So how much dosage we will inject? 0.1 ml of purified protein derivative, PPD. 0.1 ml of PPD we are going to inject intradermally. After injecting, mark the area. After marking, wait for 48 to 72 hours. In this time period, if there is a redness, we can call it as erythema, itching, or raised bumpy area, these are all the signs of infection with TB. But here, the measurement matters. Okay, if the measurement is less than 5 mm or less than 10 mm or less than 15 mm, what does it mean? That matters. Understand? Fine. So on the whole, we are going to inject, the first key point is 0.1 ml of PPD intradermally. Second, we have to wait for 48 to 72 hours and check for induration. And third one, we have to check for the size of induration in millimeter. Let's see this one also. See, for a healthy person who got infected with TB and you have done Montax test. So for this person, how much induration will be there? It should be more than 15 mm. The induration will be more than 15 mm. Okay. People with risk factors. For example, my family members, one of the family members got TB and I am frequently exposed to that particular TB patient. I am frequently, as a nurse, I am exposed to the particular TB patient. Okay. And I also got TB. So if you are checking me, I doesn't got TB, but I am frequently exposed to the TB. If you are checking the TB or if you are doing the Montax test to me, it will be around 10 mm. And for the immunocompromised patient or for HIV patient, it will be more than 5 mm. So for a HIV immunocompromised patient, more than 5 mm means it is positive. For a people with risk factors, more than 10 mm is positive. And healthy people who got infected with TB, Mycobacterium tuberculosis, more than 15 mm is positive. And also I am saying this is not a confirmatory test. You have to go with the CBNAT, that is sputum culture. Okay, fine. So these are all the induration measurements. Okay, Here we can just suspect whether the patient is having TB or not. It is not a confirmatory test. Understand? So these are all the golden points which is related to one text. The next one, Schick test, is used to determine the susceptibility of. See, Schick test also we are using intradermal injection, and for Montex test also we are using intradermal injection. So in this question what they are asking, Schick test is used to determine what? Measles, diphtheria, rubella, pertussis. 4 options they are given here, and here the right answer is option B. Schick test is used for diphtheria. Direct question, direct answer. Golden points? Yes. See, Schick test, it is an intradermal test, as I mentioned already, to determine the susceptibility of diphtheria. First golden point over. Second one, what is there in the Schick test? What injection we are giving in the Schick test? It involves injecting the diphtheria toxin into the skin. What toxin we are injecting? Diphtheria toxin. In order to check diphtheria disease, we are injecting diphtheria toxin into the skin. Obviously, positive reaction means the person is susceptible. Negative means the person is already immune. Okay, fine. So these are all the additional point which is related to the Schick test. Schick test, diphtheria, injecting diphtheria toxin intradermally. That's it. Okay. Next, which of the following are the water soluble vitamin? See, 2 types of vitamin: water soluble vitamin, fat soluble vitamin. You all know that fat soluble vitamin are A, D, E, and K, right? So it is already mentioned here, A, D, E, and K, right? So here in the question they are asking for water soluble vitamin. So in this, which doesn't have A, D, and K? In option C, A is there. Option D, D is there, right? So we can eliminate option A, C, and D. And what else is remaining? Option B. So vitamin B complex is a water soluble vitamin. Okay, so you can see here 2 things are water soluble vitamin, guys: vitamin C and vitamin B. B means B complex. Okay, in B complex, all the B vitamins will be there: B1, B2, B3, B5, B6, B7, B9, B12. Okay, and vitamin C. B and C are water soluble vitamin. A, D, E, and K is a fat soluble vitamin. That's all. Direct question. Okay, mostly students will make mistake in the simple question. That's the math. Okay, fine. So Bell's palsy affect which cranial nerve? Bell's palsy, a very common question. Bell's palsy, it affects which cranial nerves? So 4 option is there: trigeminal, facial, glossopharyngeal, vagus. Trigeminal is the longest nerve. Sorry, trigeminal is the largest nerve. It is not a longest nerve. Trigeminal is the largest nerve. It supplies the face. And vagus is a longest nerve. And facial nerve is the 7th nerve. If it is get infected, it is called as Bell's palsy. Understand? Right? So here the Bell's palsy affect which cranial nerve? Right option is option B, that is facial nerve. Okay. The golden point is Bell's palsy causes sudden weakness and paralysis of the muscles of one side of the face. That is important. One side, unilateral side is getting affected. Okay. It happens because of the inflammation of the facial nerve. It will recover on its own. Okay, guys. Fine. The next one, measles vaccine is given at which age? Again, direct question. At birth, 6 months, 9 months, 15 months. 4 options they have given here. Measles vaccine is given at which age? Very simple, direct question. The right answer is option C, 9 months. Okay. Additional dose is given on which month? First dose, 9 months. Additional dose, booster dose on 15 to 18 months. 9th month, double the 9, it is 18. Okay, so 9th month first dose, second dose on 15 to 18 month. Remember that. Okay, and question number 20. Xerostomia is also known as, direct question, xerostomia is also known as dry mouth. Dry mouth. These are all the questions asked in the PGI exams. Okay, next. A patient has neck and laryngeal cancer and is receiving chemotherapy. What will be the most common complication? Complication is the question for the person who is receiving chemotherapy for neck and laryngeal cancer. Face, it is the head and neck is exposed more. See, in chemotherapy, mostly rapidly multiplying cells are easily getting damaged. That is the function of chemotherapy. What is chemotherapy? It destroys the rapidly multiplying cells. What are all the rapidly multiplying cells? The first one is cancer cell. Chemotherapy kills the cancer cells because it multiply very fast. Second thing, hair. Hair also multiply very fast. So if you started with chemotherapy, hair fall will be there. Third, mucous cells, which is there in the mouth. Mucous cells, which is there in the mouth. It is also rapidly multiplying. Even the nails, the skin, these things are rapidly multiplying. But here, the cancer is there in the neck and larynx. So you are starting with chemotherapy. So the chemotherapy will affect the oral mucosa. Oral mucosa is rapidly multiplying cell. It affects the oral mucosa and it will cause what? Mucositis and sore throat. Okay, so here the right answer is what? Option B, mucositis. Okay. The next one, while administering protamine sulfate to a patient receiving heparin therapy, what is the priority nursing assessment? Very important, already asked in the exams. You know that heparin, the antidote is protamine sulfate. So, whilst the patient is already started with the heparin maintenance dose is going on. And now we are introducing the protamine sulfate, antidote for heparin. So, while introducing the protamine sulfate, what are all the things we supposed to monitor? Already heparin is going on to the patient. You are introducing the antidote protamine sulfate. Now we want what we supposed to monitor. 4 options are there. Monitor BP and slow the infusion. Observe for allergic reaction. Administer drug rapidly. Encourage deep breathing exercise. And here the right answer is going to be option A. That is, while you started with protamine sulfate for the patient who is already getting heparin, you have to monitor the BP and slow the infusion. Why? Protamine sulfate, why we are in giving? Protamine sulfate is given to reverse the effect of the heparin. That's why it is called as antidote. But if you are giving protamine sulfate, you have to monitor the blood pressure because it will cause hypotension. You have to monitor heart rate because it causes bradycardia. Understand? So, and also one more thing, you should not give too fast. The infusion, protamine sulfate infusion should be very, very slow. So, monitor BP and slow infusion. Both are there in the option A. So, we selected option A. Okay, fine. The next one, the client needs to learn the use of Walker acquisition of this skill will require learning in that. See, the person is trying to use the Walker. He is learning a new skill. And this skill is coming under which domain? This is the question. Simple. Affective, cognitive, psychomotor. 3 options are there. Okay. Let's see. The right answer is option C, psychomotor. Fine. So what about other 2? Affective means, cognitive means what? Psychomotor means what? You should know the knowledge. You should have the knowledge about these 3 things. Cognitive means intelligence, knowledge. Physical skill doesn't matter at all. Understand? Whereas for using the Walker, physical and mental skill both are required. Both are required. In cognitive, only mental skill is there. Physical skill is not there. So you can eliminate cognitive domain. Second one is affective. Affective is totally different. It related to emotion, feelings, attitude. It doesn't related to the question at all. Eliminate it. And what else is there? Psychomotor. Psychomotor. Psycho means intellectual. Motor means physical skill. For using a Walker, definitely we need mental skill as well as the physical skill. So the right answer is going to be option C, that is psychomotor domain. Understand? So option C is the right one. The next question, a patient is taking prednisolone. Very important, repeatedly asked question. Which parameter the nurse should assess so closely? Moon-like phase, that is in Cushing syndrome. Blood glucose level, yes, we have to think about that. Ear discharge, no need to worry about ear discharge, it is not at all connected here. Hair growth, nothing. So, which is the leftover option? The right answer is option B, that is blood glucose level is 280. See guys, please remember that prednisolone, it is an intermediate acting steroid. If you are administering prednisolone, it will increase the blood glucose level by inhibiting the insulin secretion. Not only prednisolone, even cortisol. even growth hormone. Okay, so all these things will, even the drug like phenytoin, the drug which is used for seizure, all these things increase the blood glucose level and decrease the or inhibit the insulin secretion. In this case, what will happen? The blood glucose level will increase. Understand, right? So prednisolone, we have to closely monitor. If you are giving prednisolone, you have to closely monitor for what? Blood glucose level, because it will increase the blood glucose level. So here the right answer is what? Option B. And the last one, after a above knee amputation, there are different types of amputation: slime amputation, above knee amputation, below knee amputation, toe amputation. Okay, fine. So in this question, they are asking about what? Knee amputation. So knee amputation, above knee amputation. After above knee amputation, the recommended position is. So they are asking for recommended position for above knee amputation. Here, two strategy we are using. One is after the surgery, first 24 hours and after 24 hours. After surgery, first 24 hours and next 24 hours. What position we supposed to give? Okay, so this is very important one. The right answer is after the above knee amputation, the recommended position is supine with the stump elevated. Fine. This is for first 24 hours. This is for first 24 hours, supine with stump elevated with pillow to reduce the swelling and edema. What about second 24 hours? Prone position for at least 20 to 30 minutes for several times a day. Several times a day, 20 to 30 minutes prone position we have to give to the patient to prevent the hip flexion contracture. Clear? Right? So, and what we supposed to avoid? We should avoid, tell the patient not to sit long and keeping hip bent. Okay, fine. Why? It prevent the contractures. If the person is sitting for a long period of time, prone for contractures. So on the whole, first 24 hours supine, stump should be elevated. After 24 hours, prone at least 20 to 30 minutes, like that several times to prevent the contractures. Clear, guys? Right? Fine. So this is just a few question revisions, important question revisions. Same like that, continuously we will do previous question paper solutions frequently. So watch the video continuously. Already NORCET 10 exam dates are announced. It is on April first week. So keep preparing yourself, and if you want to join Metier Academy, it is well and good. You can join us and start clearing in the first attempt itself. And if you have any doubts anywhere related to this video, please drop your message in the chat box. And if you want to contact us, the contact details is there in the bottom of the slide. You can contact us and you can get the guidance from us. Okay, so thank you very much and all the best for your upcoming examination, guys.